sort of to provide an overview of the Budget Control Act, how we got to where we are, and give some of the basics of what we're going to be talking about. So I want to start really broadly and kind of determine what got us to this point, why do we have a deficit, and what does that mean? Very simply put, a deficit happens when the government spends more money than it takes in revenues. And this is something that often happens in fiscal years, but in 2000, the U.S. government actually had a surplus of over $237 billion, which was the third consecutive surplus and one of the largest surpluses we've ever had. So the question is, how did we get from that surplus in 2000 to the almost $1.3 trillion deficit that we're at right now? And I think it's important to understand how we got there, and quite frankly, one of the big reasons is the Bush-era tax cuts as well as the wars in Iraq and Afghanistan. And that alone contributes not only to 50% of the current fiscal year deficit, but also to the overall U.S. debt, which will climb to about $20 trillion over the next 10 years. And so again, we have the tax cuts and the wars in Iraq and Afghanistan accounting for almost 50% of that debt. And contrary to what a lot of folks have been saying as far as the effect of recent legislation to enhance the economy, the stimulus law and other financial laws that we've enacted actually account for only less than 10% of the overall debt. We can move to the next slide. I do think it's important, though, to get a sense of deficit spending over time. And if we look at this slide, we can really see kind of how the deficit has moved up and down since 1971. And if you look here, we can see the green column, which is the federal government spending, compared to the blue column, which is the amount of revenues that we take in, and then the yellow portion, which represents the federal deficit. So if we look over time, we can see that deficit spending is not a new concept for our government. But again, going back to 2001, we see that there was actually a surplus in that year. There was no deficit, and we're talking about that white column there. So again, getting from 2001, where we had a surplus, to 2011, where we have one of the largest deficits we've ever had, is, again, in large part in response to the wars in Afghanistan and Iraq, as well as the Bush-era tax cuts. So it's important to keep that in mind. Next slide. So going back to what is deficit reduction and what does that mean? Well, right now the federal government spends more money than it brings in through revenue. And again, that difference in spending and revenue over time has resulted in an overall federal debt which is over $14 trillion. And so on a yearly basis, the government also creates this deficit, which again, the yearly difference between what we take in and what we spend. So to address this issue of the looming federal debt and the yearly deficit, Congress and the President came to an agreement in August 2011 about how we were going to kind of tackle that issue. And we'll get into the specifics of that agreement in just a minute. Next slide. So I think it's important to understand when we talk about reducing the deficit, reducing the amount of money that the government is spending, we need to take a step back and understand what's really at stake here. So by itself, without any revenue increases, deficit reduction means a reduction in spending and spending on important federal programs and programs that are really essential to the HIV and AIDS community and the folks that we work with on a daily basis. So put simply, reducing the deficit without any increase in revenues harms essential programming such as the Y and Right program, prevention funding. It could harm entitlement programs. So it's really important to keep in mind that as a community, we cannot just let deficit reduction occur through a reduction in spending. It has to be a balanced approach that incorporates revenue increases. Next slide, please. So in thinking about deficit reduction, it's important, again, to understand that the differences as far as what needs to occur is not necessarily that we need to reduce the deficit. I think everybody actually is in agreement on that score. The question is how. And so when we came into this process, the HIV community came around together to sort of think about what are the most important priorities to us as we move through this process. First of all, as we discussed, deficit reduction must include revenue increases. That means a fair and balanced approach to this crucial problem. Second, it's crucial that we protect the vulnerable populations, including low-income people with HIV and AIDS, and funding for crucial health and HIV programs. These include health and prevention programs, research, Medicaid, all the programs that we rely on to provide essential health services. And I briefly alluded to Medicaid. That's another one of priorities. It's really important to protect Medicaid and Medicare, which of course Medicaid being one of the largest sources of care for low-income people with HIV and AIDS, and again, just a crucial program for the community. And finally, we need to continue to fund healthcare reforms that will improve quality and cost effectiveness in delivery of care. And of course, that includes protecting the incredible Affordable Care Act, which could really mean an increase in so many people receiving health care. Next slide, please. So again, where are we in this process? So I mentioned that the Budget Control Act of 2011 was passed in August, and I think it's helpful to think about that in two separate steps. The first step was in August 2011 when the act was passed. And the first piece of the act was really about increasing the debt ceiling, meaning essentially that Congress allowed the United States government to continue paying its bills. Another piece of the act at that time was that Congress would be required to vote on a balanced budget amendment to the Constitution by December 31st, 2011. Now, of course, the balanced budget amendment being an amendment that would require the government to take in just as much money as it's spending. The second part of this first step was immediate spending cuts for defense and non-defense discretionary programs in the amount of about $900 billion over the next 10 years. And in this first sort of round, it's important to understand that Medicare, Medicaid, Social Security, and other low-income programs at that time were exempted from those $900 billion cuts. And again, we'll get back to sort of what that means to be an exempted program as we move through this presentation. Next slide. So the second part of the Budget Control Act, as many of you are probably aware, was this requirement that the Congress create a bipartisan joint super committee. And this committee was tasked with recommending an additional $1.2 to $1.5 trillion in deficit reduction. Now, the amount of power that this committee was given was really sort of unprecedented in what they could recommend. They essentially were given the power to recommend changes to taxes, so increasing revenues. They were empowered to make changes to entitlement programs like Medicaid, Medicare, as well as discretionary spending like the Ryan White program. But the other piece of the Budget Control Act stated that if this super committee did not come up with a proposal by November 23rd, then the law requires automatic cuts to both defense and non-defense programs. And again, with some entitlement programs exempted, and we'll get into a little bit more about what those automatic cuts will mean in just a minute. Next slide, please. So we see here the super committee did not reach a deal. Therefore, these spending cuts are triggered. And as I mentioned before, these cuts did not affect Medicaid, Social Security, and certain other entitlement programs. It also severely limited the cuts that could be made to Medicare. It's also important to keep in mind that these cuts will not actually take effect until January of 2013, and then they will go into effect over the next 8 years. And further down in the presentation, we will kind of get into a little bit more about what those automatic spending cuts really mean for our community. Next slide. So what's the takeaway point here? What do we think about this fact that the committee did not reach a deal? And I think it is important to understand that no deal is significantly better than what could have been a really, really bad deal for the community. First of all, the super committee's proposals that were going back and forth, for those of you who may have been paying attention, almost all of them, as far as the super committee, Democrats and even the Republicans, all included cuts to Medicaid and Medicare. The initial super committee Democratic proposal included a large amount of cuts, about $500 billion, and the Democrats also included, the Democrats included about $500 billion, and the Republicans included about $700 to $800 billion in Medicaid cuts. So those could have been potentially extremely damaging to the community. Not only that, besides the basic cuts in funding, they were also, batting around a lot of different ideas around how to reform Medicaid. Those ideas could have included things like repealing the maintenance of effort requirement, which essentially says that until health care reform is enacted, states have to maintain their current eligibility level. It could have included a proposal such as block granting, essentially a cost shift from federal government paying for Medicaid to pushing more of those costs onto the states. So again, this could have been a hugely disastrous occurrence for the HIV and AIDS community. And for now, the automatic cuts don't include Medicaid, and the Medicare cuts are much more limited. Next slide. However, this is not the end of the story. The fight is not over. As we'll get into in a little bit, discretionary programs, and that includes programs like the Ryan White program, may face cuts as part of this automatic process. In addition, Congress, as you've been paying attention over the past couple weeks, is currently considering additional cuts, i.e. making cuts beyond the automatic cuts that are required. And some of the proposals have included things like slashing the Prevention and Public Health Fund and some other pretty terrible ideas that we'll get into in a little bit. And furthermore, just because Medicaid is protected from the automatic cuts, does that mean that Congress is prohibited from making additional cuts in the future to these programs? And third, revenue increases are still needed. We cannot possibly cut the deficit just in spending alone without cutting essential services for people with HIV and AIDS. So we have to continue to work together to protect our priorities. And now we're going to move on to the next piece of our presentation, which will go into a little bit more about what we're talking about with these automatic cuts.
Great, thank you so much, Melinda. That was Melinda Elwood with Harvard Law School Treatment Access Expansion Project. And now we're going to turn to Ronald Johnson from AIDS United to talk about where we are now and the automatic cut process. Ronald, take it away.
Thank you, John, and thank you to everyone participating on this webinar, and welcome. Just a little housekeeping detail. If you want to ask me a question or pose a question to me, you can do so by clicking on Donna Cruz, since she and I are in the same room, and we're registered under Donna's name. So just that little housekeeping detail. But wanted to get into what may be the more intricate or if not confusing part of this webinar, and an explanation as cleanly and simply as possible of what the automatic cuts are and how they will work and what they will possibly mean. Next slide. Next slide. As Melinda pointed out, a key provision of the Budget and Budget Control Act was an enforcement mechanism to make automatic spending cuts if the Super Committee did not reach an agreement. And the process by which these spending cuts would be made is called sequestration. A weird term, but that is the technical term by which these automatic cuts will be made. Of course, as we all know, and as Melinda pointed out, the Super Committee did not come to an agreement. So therefore, under the terms of the Budget and Budget Control Act, the sequestration or automatic cuts process will go into effect. Next slide. And again, as Melinda pointed out, the sequestration process, which has now been ordered because the Super Committee did not reach an agreement that Congress could act upon. But the actual cuts don't go into effect until January 2 of 2013, which is around the corner and a long way off. A long way off in the sense that a lot can happen between now and January 2 of 2013, not the least of which are the November 2012 elections. And it's quite possible, we'll probably talk more about this later on, that Congress can change the rules again to alter or even repeal the automatic cuts process. But for now, the sequestration or the automatic cuts is the law of the land, and those automatic cuts will go into effect in January of 2013. Next slide. The cuts call for, under the Act, the total amount to be cut is $1.2 trillion. And it's important to reemphasize that this is deficit reduction all by spending. There is no revenue growth mandated in this enforcement mechanism to reduce the deficit. This $1.2 trillion in the automatic cut sequestration process is all spending cuts. Also want to point out, and we should keep in mind, that this $1.2 trillion is on top of the nearly $1 trillion that is already mandated in the Budget and Control Act and the spending caps that are in effect already starting this fiscal year 2012. So this $1.2 trillion in automatic cuts is on top of the nearly $1 trillion cuts that have already been mandated and are already being put into effect with the spending cap starting with 2012. And Donna Cruz will talk a little bit more about that. However, Congress did exempt some programs, and I want to highlight and begin this section by noting the core domestic low-income entitlement programs that have been exempted from the automatic cuts process. The first and foremost, perhaps particularly for our constituencies, is the Medicaid program, and also the Children's Health Insurance Program are exempt. They will not be subject to automatic cuts under sequestration. Other programs, mandatory programs that are exempt from the automatic cuts include the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps, or still colloquially known as food stamps, child care entitlements and child nutrition, some of the earned income tax credits and child tax credits, supplemental security income, SSI, and temporary assistance to needy families, the TANF program, are exempt, and Medicare beneficiaries are exempt. Now, in saying that, there will be, under the automatic cuts, as we'll show in a few minutes, Medicare will be cut by 2%, but those cuts are to reimbursement to providers, not direct benefits to beneficiaries. But I think, as all of us know, there is an indirect impact on beneficiaries when you cut reimbursement to providers. It could have the effect of forcing some providers to leave the program, thus shrinking the pool of providers under Medicare. So we have to recognize that this 2% cut, while it is not designed to have a direct impact on beneficiaries, could indeed have an indirect cut impact by affecting access to care if the pool of providers shrinks. Next slide. It's very difficult to avoid getting into the weeds of the automatic cut process and understanding the numbers and how they play out. I'm grateful to the Bipartisan Policy Center for this slide, which I think is one of the better graphic overviews, and that's why I chose to include it, of what the automatic cuts mean and the broad numbers that are associated. Going at the top of the chart, the total sequester is $1.2 trillion, and that again is spread out over the fiscal years starting 2013 going through 2021. So 9 fiscal years will be impacted by the automatic cuts. But again, the cuts start in January of 2013, so that they come during the fiscal year that has already started. So really that 2013, the cuts will be impacting on 75% of that fiscal year. Now breaking that $1.2 trillion a little further, and these are numbers that the Bipartisan Policy Center based on with the Congressional Budget Office. So this is the ultimate source of these breakdowns. Because we're reducing the deficit and the debt, there will be a lower cost of interest that the United States will be paying. And the Congressional Budget Office, the CBO, one estimate of what those lowered interest cost savings will be is $216 billion. That is that box on the second line on the right. So if you subtract that $216 billion from the overall total of $1.2 trillion deficit reduction, the actual amount of spending cuts that have to be achieved is $984 billion over the 9 fiscal years that the automatic cuts cover. And per the law, that $984 billion is split 50-50 between the defense area, national defense, and non-defense area. So the total for defense cuts over the 9 fiscal years is estimated to be $492 billion. And the non-defense total over those 9 fiscal years is another $492 billion. So that is the 50-50 portion. Now let's concentrate a bit on the boxes on the right, that is the non-defense cuts. The largest share, and the box on the far left of those blue boxes, are the non-defense discretionary programs. And that estimate is expected to be about $322 billion over the 9 fiscal years. And that is the area, of course, under which HIV programs fall. So the potential cuts to HIV programs will be out of that $322 billion that will be cut. The Medicare 2% cut is estimated to be $123 billion. And I think this is an area that I think we need to highlight. The Affordable Care Act exchange subsidy will be cut, and these are the cost-sharing portion of the subsidies under the Affordable Care Act for people purchasing insurance through the exchange. Those subsidies will be cut by approximately $6 billion over the 9 fiscal years. And then the cut for other mandatory programs that are not exempt from the sequestration will total $41 billion. So that, as I said, is the simplest overview, and it's still rather complicated, of what the cuts will mean and the broad categories of the cuts over the 9 fiscal years. And again, the $984 billion in spending cuts split 50-50 between defense cuts and non-defense cuts. And then within that non-defense category, there are also 4 large boxes for the spending cuts. Next slide. The process for making these cuts, the cuts will be spread out in equal dollar amounts over the 9 fiscal years starting in FY 2013. But again, with the cut starting in January, that fiscal year will already be in place. So the process for 2013 is expected to be somewhat different from the process for the following, the subsequent fiscal years. The Congressional Budget Office estimates that in 2013, non-defense discretionary programs, again, that's the pot of money from which HIV programs are funded, will be reduced by broadly, totally 7.8%. And in 2013, this will be administered by an across-the-board cut in the appropriations for 2013. By that time, the 2013 budget should be in place and the appropriations made, so those dollar amounts should be known. So it will again be just an across-the-board cut, approximately 7.8% in all funding for 2013. In 2014, starting in 2014, the appropriation committees will have more control, because for those funding years, it's a reduction in the spending cap, and then the appropriations process will determine which programs get exactly what hit is to each program. Overall, the Congressional Budget Office estimates that the cut will be about 7.4% in 2014 and a somewhat declining percentage point cut in subsequent years. But again, how those programs, how those cuts are apportioned to individual programs, including HIV programs, will be part of the appropriation process. Next slide. I want to point out and note that the Budget and Control Act will not by itself control the deficit and federal debt problems, but will have a significant impact on discretionary spending, especially for domestic non-defense programs, including HIV programs. Next slide. And to get some impact, even before the Budget and Control Act was enacted, the CBO projected domestic spending to really be on a downward slope over the next 10 years. Next slide. With the Budget and Control Act, we can really say, and again, I'm thankful to the Bipartisan Policy Center for this graphic slide just to show the impact, that domestic spending will really be cut to the bone. That bottom line, the green line, is what the slope of domestic spending cut as a share of the gross domestic product will be as a result of the Budget and Control Act and the full automatic cut sequestration process. So domestic spending is really going to be hit over the next 10 years. And this is something we really need to keep in mind when we talk about how HIV programs, implementation of the national strategy, just the pool of money that's going to be available is going to be shrinking over the next 10 years. And that is really gets to the kind of advocacy that we'll be talking about going ahead. But at this point, I'll turn it to my colleague, Donna Cruz, who will talk about the FY 2012, which is the year that we're already in, and the process is still not over, and Donna will give us a quick overview of what all this means for the current fiscal year 2012. Donna?
Hi, everyone. Thanks again for joining us today. We're pleased, actually, that we actually set today as the date for our session. We have some up-to-the-minute information to share with you. This morning, a little bit after midnight, Chairman Rogers, the chairman of the Appropriations Committee in the House, introduced legislation, an omnibus bill for the remaining 9 bills that have not yet been passed for fiscal year 12, which began October 1st. One of the things we're quite concerned and upset about this morning is that this legislation reinstates the federal the ban on the use of federal funds for syringe exchange programs throughout the country. It really is a blow to our community, both HIV and hepatitis. We've shown and know that the syringe exchange programs work, decreasing drug use as well as increasing folks into treatment and care for that instance. But right now, that has been reinstated in the bill. It's both in the in all federal funding, so that would also include any federal funds that are used overseas through the PEPFAR program for HIV as well. The ban doesn't include, DC will be able to use their local funds for syringe exchange programs, and that is one good piece of news, but the federal ban has been reinstated in this legislation. This legislation hasn't passed by any means. It was just introduced, as I said, midnight today, and it has been posted with the possibility of passage, with the possibility of a vote on it on Friday this week. It includes, again, all 9 appropriations bills, and there's some across the board, 2 across-the-board cuts in the bill as well. One cut that's 0.189%, and that would be across all of the health spending at HHS. We're not quite clear how much that would be right now. We're still working on those numbers, but it is something that's going forward. This bill was introduced this morning because the the House and Senate had been working on a bipartisan conference report for these remaining 9 bills, but they had not yet come to an agreement. So it's not clear, first, if this bill can pass the House with only Republican support, because many Republican members have said that they don't like this top line number that has come from the Budget Control Act, but it will be a, and Democratic members have said that they won't be voting in favor of it. The Senate, both Senator McConnell and Senator Reid have said that they hope that they can work out the differences on the conference report that they were working on and come to an agreement, and that the House won't go forward with this legislation. But this legislation has been introduced. So going back to our presentation that we finished yesterday, which is why you don't have these slides in it, I just have a few glossary of terms. It's often difficult to talk about this information without a common understanding. So appropriations in Congress is the process by which Congress, both the House and the Senate, provide new budget authority for discretionary federal programs. In theory, there are 12 appropriations bills. But as I said, we are talking today about a nine bill package. So they have not passed all individual bills in quite some time. There have been three of the 12 bills have passed and been signed by the President, but there are 9 that remain. Again, as we said, the fiscal year begins begins October 1st of every year. So fiscal year 2013 will run from October 1st, 2012 through September 30th, 2013. This fiscal year 12, which is what we're in now, started October 1st of this year. And a rescission, you often hear about as we've been having all these conversations, is canceling any money that has been appropriated. Next slide. And the next 2 slides are really just for your information later on. Discretionary spending is a lot of the funding that is the HIV portfolio is included in. It's programs that Congress determines each year how much they will allocate. Mandatory spending are programs that people are entitled to participate in because of their eligibility requirements. Often it's financial, or through Social Security, for example, by age. So this is just kind of just some information for you to have and refer back to. Next slide. Again, budget authority, budget outlays, budget resolutions, just some definitions for you to have. Next slide. So we wanted to give you kind of a sense of the next, the budget and appropriations calendar. So each year, on the first Monday in February, next year it will be February 6, 2012, President Obama will release his FY13 budget. There will be congressional budget committees reviewing the budget and bringing in the administration secretaries to have hearings, and that's usually that first week once the budget is released in February. Once the budget is released and conversations start, the appropriations committees begin, the Congress adopts the budget, starts talking about the budget resolution that they would put out that's not non-binding, but is often is put out around April 15th. This year, the House put a budget resolution out, but the Senate did not. They're not required to do it, but they do try and do that. After sometime between the President's budget coming out and the budget resolution, the 302A allocation. So that's the amount of money that the full Appropriations Committee in both the House and the Senate would receive for for all funding for their 12 subcommittees. Then, so that's happening usually in the House in March and the Senate in May. For the subcommittees, it's called a 302B allocation. And in the House, they usually get those breakdowns in April and the Senate in June. And that's the determining factor on how much money each of these 12 subcommittees can spend and appropriate for the different programs that they're responsible for. And appropriations hearings begin around that same time. Again, April, June, or July in April, May in the House, and June or July in the Senate. Then floor action follows as the bills go through subcommittee and full committee if they're acting in a regular order. Again, that would be June or July in the House, and in the Senate, July and September, with the aim of finishing by September 30th. They'll have conference committees ongoing as each body is finished their appropriations, because oftentimes the House has a different 302B allocation than the Senate, and there are always different amounts of funding that go from one pot to one program as opposed to another program, both in the House and Senate. So they have to come together, the House and Senate members, to conference to make the bill one bill that they can send off to the President. This, again, as I said, is an ideal, not real timeline. None of this kind of happened in this fiscal year 12 that we're in right now. This final package, though, the package of 9, was gone through, the last couple of weeks has been this conversation ongoing for all the 9 bills. So on October 1st, all the appropriations bills have to be signed or a continuing resolution signed to keep the government functioning beyond October 1st. And as has been said earlier in the presentation, sequestration will begin January 2nd, 2013, partway into the FY13 calendar year. Next slide. So for this FY12 appropriations, the total is $1.043 trillion. This amount is higher than the House-passed budget that Congressman Ryan, the chair of the Budget Committee, had introduced, and the Republican members had based their FY12 appropriations bills on. It's 4% lower than the current spending, but the House and the Senate have now agreed that this FY12 spending amount that was set in the Budget and Budget Control Act is the number that they're working with. It took quite some time to agree to that, and there are some Republican members of the House that still don't like that number and have said that they're not going to vote for any bill that would include that number. Next slide. So within the domestic appropriations portfolio, the only bill that's received its FY12 amount is the HOPWA program, because it was part of the 3 package that went out earlier last month. And the HOPWA received $332 million, a $2.3 million cut from FY11. But the majority of our package is in this mega bus that is being conferenced, and the bill that was actually introduced today by Chairman Rogers. The total package for this bill is $915 billion. That's the remaining amount from what has passed already to this 1.043. Next slide. So this is what we knew yesterday. Let me start there. So the House, in the House, the Labor, Health, and Human Services bill did not pass the House Appropriations Subcommittee, Committee, or the floor. So Chairman Rayburg, who's the chair of the Subcommittee on Labor, Health, and Human Services, put out a proposal. And this represents his proposal. It does not represent Chairman Rayburg's amount today. And then the next column would be the Senate bill that was included, the community request there, and the last column on the right is the President's request from World AIDS Day, and that was for $15 million for Part C in Ryan White and $35 million for ADAP. but that has to be included in this packet, in this final package as it comes through. We would have been told that it would be included from the Prevention and Wellness Fund. I have not been able to confirm that it is in the bill that came out from Chairman Rogers earlier today. I will say that when Chairman Rayburn put the proposal out, that Prevention and Wellness Fund was zeroed out. The Senate did have it in, but when they passed their bill, but that was prior to the President making this announcement. So that $50 million from the President's World AIDS Day is something that we are still following. I will say that the bill that came out today from Chairman Rogers did include the $15 million for ADAP, that increase there. And there is an increase for NIH, but I'm not sure of the amount of that increase. Next slide. So the policy riders of the syringe exchange, one that I talked about earlier, is making it very difficult for many members to support this bill, both in the House and in the Senate. And the White House is not pleased with many of the riders that are included in this bill. And there also the bill that was put out today, and we understand the conference bill that this bill is based on. We're not clear if this bill has everything that the conference committee included or not. The Senate staff now is doing a comparison of what they had agreed to in the conference 9 package and what this 9 package comes out with. But one thing that is in this bill also is an inclusion of $5 million for the ineffective abstinence only program, which had been zeroed out for the past few years. We vehemently oppose the inclusion of both of these provisions in the bill. Next slide. So the reason that the agreed upon conference bill was not finalized earlier this week is that the Senate had asked for the bill to be held because they wanted to get an agreement on how to extend the payroll tax holiday, how to extend unemployment insurance, and avert a 27.4% cut in Medicare reimbursement for doctors. The House passed a bill to address these issues earlier this week, but they included some erroneous issues that the Senate does not like. The one that comes to mind that you've probably heard more about is a pipeline, oil pipeline that they're trying to have included. So they didn't like that bill. That bill is supposed to fail in the Senate. So they wanted to make sure that the House stayed in session so that they could revise this bill, send it back to the House. So they held up the omnibus package. Well, right before we started this call, we understand that both Senator Reid and Senator McConnell, the leadership, the Democratic and Republican leadership in the Senate, were both on the Senate floor saying that they can come to agreement in the next few days. So they're hoping that that will be worked out soon. The Medicare, the cut in the Medicare reimbursement for doctors is important for our community, since we know that many of the doctors many HIV patients go to doctors that take Medicare and Medicaid, and we need to continue to include as many doctors as we can there. So the last piece that I'll say, that if the appropriations bill is not, if some appropriations packages, next slide, I'm sorry, is not passed by the House and the Senate and signed by President Obama by this Friday at midnight, there will be a government shutdown unless the third continuing resolution is enacted. There's been some debate, and I'm not sure where it stands now. It's been kind of jockeying on both sides, both the House and Senate, and Democrats and Republicans, if we can get a continuing resolution for one more week, or if they will let the government shut down for the weekend, Saturday, Sunday, and then, come back with the staff will be working through the weekend to come up with an agreement and then have a passage on Monday. It's just really not quite clear where things will, how things will play out. We'll continue to keep you informed, and we're continuing to try and fight this syringe exchange problem. That funding would be that the funding would be banned again, and we hope that that's not going to be the case. Next slide. Next person, I believe, is up. Yeah.
Yes. Great. Thank you. Thank you so much, Donna. We appreciate that, and Ronald, you too. It's really such tremendous information, and thank you for the endless work you do 24 hours a day. I don't know how you all have been getting any sleep lately, because the amount of work is just incredible. So I'm going to talk briefly about next steps and advocacy, and then we will wrap up. So it's really clear that our advocacy, along with our partners, the other organizations and advocates for services for vulnerable populations, have really had a significant success this year. We really got the message to Congress that cuts to vital programs were bad for their constituents, are going to be bad for the economy, and that vulnerable populations need and deserve support from federal programs. And so we need to keep this up. We have ongoing advocacy work to do. This is the work that we always are doing every year, thanks to the leadership of AIDS United and other organizations that do national work. But we will, particularly as the 2012 process wraps up and we go into the 2013 process, we have to continue to push for the highest possible funding levels in the annual appropriations process. And that is going to continue to be a major priority. And we also need to educate our community about what deficit reduction is, how the process works, and then what happens next. And a first step to doing that is with this webinar. And we're going to leave you with a couple of talking points that will help you explain deficit reduction and hopefully help you get a better understanding of it. And one of the real points that we want to hammer in today is that we need to stop the message that the deficit reduction process that's happened so far has been a failure. It was not a failure. It was a success because the low-income programs that we care about, and particularly Medicare, Medicaid, Social Security, other domestic programs, were not cut through the process that has happened so far. And so that has been an important success. So one deficit talking point is that the Super Committee has succeeded. And what we need to also continue to message is that health reform, HIV programs, and other vital programs are still at risk. So we're not out of the woods, and we need to continue to monitor the process carefully as it moves forward. A second deficit reduction talking point is that Congress and the President have to stick to the plan that they have agreed on. And Congress and the President passed a law over the summer that spells out how deficit reduction will happen, that outlines the process. And so far, they have been following it. But nothing says that Congress cannot go back and change the law. And Congress loves to change the law that they, in particular, have to follow when it becomes clear that they're going to have a hard time following it. And one of the critical issues is making sure that defense and non-defense spending are equally cut as planned. This is not a time for sacred cows. We can't let the defense industry say that their programs and that new fighter jets or new tanks or new weapon systems are more important than services for people with HIV, than Medicare, than Medicaid, than Social Security for seniors who have no income but their Social Security check. this is really critical, and this is something that we do not want to let Congress and the President deviate from. Another critical talking point as we work on deficit reduction over the coming years is that cuts are not the only option. New revenue has to be on the table as part of the solution. And any dollar that Congress comes up with in new revenue is going to reduce the amount of cuts that are supposed to happen. There have been proposals to tax millionaires. There have been all kinds of things floating around out there, and although they've been popular with most of the American people, they have not made it through Congress yet. But we need to continue to call for revenue. And the fourth deficit reduction talking point is that if Congress is serious about deficit reduction and controlling future spending, it's critical to fund HIV programs. HIV programs are cost-effective. Preventing new HIV cases saves money. Providing early treatment saves money. And supportive services like housing save money. And in addition, for people who are at risk of HIV, knowing your status is deficit reduction. If you know you're positive, you can get into treatment and get services that will prevent transmission to others and get into care. So it is those cost effectiveness and cost efficiency messages are going to become more and more critical for us to hammer home as we do our advocacy. And as we wrap up, I want everyone to again look at the HIV community's deficit reduction priorities. And the four that we discussed previously are the deficit reduction has to include revenue increases, vulnerable populations and funding for health and HIV programs have to be protected. We have to protect Medicare and Medicaid and continue to fund health care reforms that will improve quality and cost effectiveness in delivery. So this is going to be a roadmap for certainly the coming year and beyond as the process moves forward. So a couple final thoughts. Deficit reduction is really going to be a critical issue in the 2012 elections and the political environment for years to come. It's the programs that are at stake for people living with HIV, for the programs that we care about, mean that voter registration in the upcoming elections are going to be critical. Get out the vote efforts will be critical. Educating voters on where candidates stand in a nonpartisan way is going to be essential. And as we move into the new calendar year, we'll be providing information on how to conduct voter mobilization efforts. And it's also, as a final point, really critical to keep in mind that the United States has a spending problem, and that spending problem comes from wars overseas, from tax cuts that were made in the early part of the 2000s, and that ending wars overseas as it's starting to happen and raising revenues is going to be part of the solution. So we are, here's some contact information for all of us, and here are some resources that you may wish to check out. We will be posting this presentation as well as the recording on our website, hivhealthreform.org/blog, and others. So we encourage you to check that out in the future, and we'll notify all of you when it's been posted. If there are any questions, please use the chat feature to answer them. And we have a couple that I'm going to share. First of all, if you're interested in checking out the omnibus bill number, it's HR 3671, and if you go to Thomas, as in the name Thomas, .loc, as in Library of Congress.gov, you can look up that bill number. So the first question was raised by two people, and this is a question for Ronald. And the points were that the amount of budget cuts will be more than 7.8% because CBO estimates did not consider exempt programs. And one person noted that the Center on Budget and Policy Priorities estimates an 11% cut between fiscal year 11 and 12 as a result of the CBO differences. Do you want to comment on that, Ronald?
Yeah, I think that is a valid point, and one of the reasons why I really was reluctant to put a slide together with numbers, because there are such varying estimates as to the percentage cuts, as the questioner pointed out, and various ways of analyzing and putting in which programs are going to be actually affected can alter the percentage cut. I think, and since we're talking 2013 and numbers that are on paper and not real yet, it also will vary. I think it's fair to say that the percentage cut is going to be very, very broadly between 8%, which are roughly what the CBO estimates, going up to possibly 11% or that the chat person identified. I think that's all within the realm of the possible, because, again, depending upon which programs and the spending, and when also the difference between which the Congressional Budget Office makes between budget authority and actual outlays will determine variations that you undoubtedly will see in the percentage cut. And again, that's why I was reluctant to get too much into what I call the weeds of the numbers, because the variations are so broad. But I think it is suffice to say that there will be a significant cut to discretionary spending. How, though, that cut gets felt in individual programs, including HIV, remains to be seen. We don't know what the 2013 numbers are from which the automatic cuts will begin in 2013. And in the future years, 2014 to FY 2021, as I said, a lot of that will depend upon the appropriation process itself and who is sitting in the room. And that's why I also want to bring it back to what John said about the election. Elections matter. And who sits in the room and who will be making these decisions and who will be, which will impact on the final percentages, whether it's 7% going up to 11%, is going to be very, very critical and very dependent upon the degree to which we involve ourselves in the election process, particularly next year. So that question, all to say that that question is a good one, and it just underscores the wide variety and possibilities that are still in play, even with the automatic cut process.
Great, thank you, Ronald. Another question that has come in is, rather than advocating for equal cuts to defense and non-defense, would it be better to call for a complete repeal of sequestration? Even if cuts are equally split, the effect on public health will still be devastating. Ronald or Donna, do you want to take that?
I think that is an option that we certainly need to consider. I think it's a little too early to say, to call for complete repeal, particularly when we don't know again, who are going to be the decision makers. I would not be happy, or I shouldn't say happy, I'd be reluctant in the current makeup of Congress where to completely remove that, at least that firewall of 50-50 between defense and spending cuts, and the exemption of important programs, including Medicaid, SNAP, and other entitlement programs. I think we need to hammer home that reducing the deficit cannot be and must not be through spending cuts. So we need to hammer home the message that, particularly if we were to get repeal of sequestration altogether, that deficit reduction must include significant revenue growth, that cuts to programs, particularly programs that affect the vulnerable populations, low-income programs, healthcare programs, that cannot bear the brunt of deficit reduction. So these are the factors that I think we need to think out when we look at whether repealing the automatic cuts completely is going to be in our best interest. Because we have to think of, if it's a given that we have to reduce the deficit, and I think there are valid arguments, economic arguments, why deficit reduction and reducing the total debt is important and important to HIV, then we have to be very strategic in thinking about how the deficit is reduced. And again, we must insist on a balanced approach that includes revenue.
Thank you again, Ronald. Another question that has come in, and Donna, this is one for you, is have we been partnering with other nationwide large organizations such as AARP? Could you talk a little bit about some of the coalitions and partnerships that AIDS United and others have been engaged with?
Absolutely. This year, AIDS United and a few of the other HIV groups have partnered with the broader budget coalition here that meets often here in D.C. to look at the broader issues of those that are poor and disenfranchised. There's another coalition, Save for All, that has come together around this issue. How do we make sure that each of the programs that we care about in the broader sense, and it has been that coalition work, among others, that made sure that we had some programs that were exempt from the possible sequestration. The work that is done can't be done in silos, and we really have reached out to broader communities. AIDS United also works closely with the Coalition for Health Funding, and that is a coalition that works on the larger budget, the entire health budget, making sure the entire health budget is increased so that the Labor, Health, and Human Services allocation, Appropriations Committee's allocation is as high as we can get, so that the HIV portion can be as high as we can get. And in that, we've also worked with closely with there's a similar committee called the Committee on Education Funding, so since it's a labor, the Department of Labor, Department of Health, Department of Education, and a few other programs, Corporation for National Service, for example, are all in this one appropriations bill. And you can move money around within that bill. So those are all important programs to HIV advocates. So we don't want to have to rob from one program to give to another program. We really want to have the the entire portfolio be as broad and robust as it can be. We continue to work very much with realizing the broader community is impacted by this. We've also done with healthcare reform this year, doing a lot of work with those Families USA, for example, Healthcare for America Now, and others, that HIV is part of the healthcare discussion and debate. So we're making sure that we are keeping our foot in the door in quite a few rooms.
Thank you so much, Donna. Well, we are now at 1:15, and we're going to wrap things up. Thank you so much to our presenters, Melinda Elwood from Harvard Law School TAPE, Ronald Johnson and Donna Cruz from AIDS United, and I'm with AIDS Foundation of Chicago. If you would like to download a copy of the slides, you can go to hivhealthreform.org/blog. We will also have the recording available in a couple of days, and we'll let you know when it's been uploaded so that you can listen to it again and share it with your friends, which we know you will do. And as you exit the webinar, there will be a really brief survey, 5 questions. So please take a minute to tell us how we're doing, if there are things that we could improve, and let us know what other webinar topics you would like to see. Thank you so much, everybody, and we appreciate your participation today. Bye-bye.